Good morning, everybody, and thank you for being here. First and foremost, again, I want to thank all the first responders, everyone out there that's just working to keep us moving in the right direction. Thank you, thank you, thank you. Unfortunately, we had 4 more people pass away last night, which now brings our total up to 29. 2 males in their 80s, 1 female in her 80s, and 1 female in her 90s. So my condolences and heart go out to the family as you know they live through this difficult situation, and sorry you couldn't be there with your loved ones in their final hours, but again, my heart goes out to them, and you know, we're sorry they're going through this, and our hearts and prayers are with you, and to all the families, to all 29 families that have gone through this, our hearts and prayers are with you. Unfortunately, this is continuing to happen, and we will only have to be there in a community to be the foundation for these families that are going through their loss. So again, please, everyone out there, say a little prayer for their families, and we appreciate that. As of today, there are 713 positive cases. We're up 35 from yesterday. 811 people under mandatory quarantine. That's up by 57, and 41 people under precautionary quarantine. That's the same number as yesterday. At Shaker Place, our nursing home, it stands the same. 22 residents, haven't changed, and we've been testing not just the residents, our employees. So we're up 1 yesterday from employees. So a total of 12, 11 positive, 12 positive, but 1 recovered back to work, as I said. So a total of 12 though. We have had 1,805 people complete quarantine. Out of those, 385 tested positive for the virus and have recovered. We have 35 people that are hospitalized, and with a hospitalization rate of 4.6, those have tested positive. Yesterday, as you know, it was at 4.42. We have 7 adults currently in the ICU. It's down by 2. And to the questions I got on Facebook, the ones we report in the ICU are just the patients from Albany County. We don't report Albany, Baden, St. Peter's, or more anyone's numbers other than residents of Albany County. So just rest assured, when the hospitals put out their numbers, it's not the same as ours, because we're only reporting what happens here in Albany County. We're seeing a lot of testing results being done by UAlbany, and I can't thank the governor and his team enough for that. As we announced our partnership with Rite Aid, they're up and running today. They started at 9 o'clock. So, and our mobile testing sites have been successful. So for our mobile testing sites throughout the community, in partnership with Whitney Young, can't thank them enough, in partnership with the health department and Dr. Whalen's leadership and everyone's leadership on this. The number is area code 518-465-4771. 465-4771. Please, that number you can call. For Rite Aid, you have to go to the website. So for Rite Aid, which began today, and they're seeing a good number of people there in the town of Colony, and I want to thank Supervisor Paul Mahan again, and everyone, the town board, and all the legislators that helped us get on board with this. Thank you, thank you, thank you. And the ones I didn't mention the other day, thank you for the letters. Thank you for the support and wanting to get this done for your community. But then you go to the website, www.riteaid.com, and that will set you up for the to get appointment to get through the drive-through. I still want to remind everyone, social isolation. It's doing its job. By keeping people home that don't need to be out there, that don't need to be out in the community, it's working. It's slowed it down. I know people think this is made up. I know someone accused me of trying to fear that population of young kids between 20 and 29 from going outside. We're not. We want you to go outside. We want you to get your fresh air, but we want you to do it in a reasonable way. And if you don't think it affects kids, and I'm trying to fair-mongle younger kids, you know, look what just happened to that firefighter and the police officer's daughter that passed away at the age of 5, one of the youngest victims of this COVID-19. So, am I trying to scare you? Yeah, do the right thing, people. Parents, it's a serious situation. Kids can get it. It just 25% of them, and Dr. Whalen will talk about this better than I can, will have no signs or symptoms, but they're carriers that infect other people that can kill them. So yeah, we want you to be cautious. We want you to do the right thing. And if you don't, I don't know what to tell you. I really don't. But again, we continue to operate. And people have asked that magic question from the press and everyone else and from the Times Union, the economy, how's this affecting, how you look at things going forward. And I'll say this again, first and foremost, and I don't want to speak for our great controller, Tom DiNapoli, but we do worry about the economy. But first and foremost, it's the safety and health of our workers and the people that we represent in this great state of New York that are first and foremost. The economy second, because we can always rebuild. We're resilient. We can bounce back from this, but it's going to take time. And the outlook's going to be a lot different going into the future. So, these are things that we have to be worried about. These are things that we have to continue to look at. As I look at sales tax revenue, spending money, how much it's going to cost for different things. Hotel tax is going to be down, internet tax is going to be down, regular tax is going to be down, gasoline's at a record low, that's going to be down. So these all factor into everything of us going forward, and that's why you see a lot of companies, unfortunately, doing a ton of furloughs. Things are going to change, and we have to adapt with it. But who better than to talk about that and where we're headed with a lot of different issues. Questions I've gotten, not just internally from people, but from people on our Facebook or email in our office. So I thought no better person to bring in than our great controller here in the state of New York, who actually I have to tell you is being president of County Executives of America, and I don't want to blow your head up. When I've talked to people on a national level, they always refer back to New York State and what a great job you do here and the leadership. And I'm like, wow, that makes me feel good. Now, at least I know my money's safe. So I do want to say thank you for that. But Tom DiNapoli, please.
Thank you. Thank you, County Executive McCoy, for inviting me to be here with you, and thank you for your great leadership during this extraordinary time. I spend a lot of time in Albany, still technically a resident of Long Island, but I'm here a great deal, and as I said to Dr. Whalen when I walked in, I've tuned in to many of your briefings, and you really are keeping your residents informed as to what's going on, and I think communication is so important. People are following, by and large, your direction of staying socially isolated, and that isolation reinforces a sense of what's going on out there. I need to know what's going on. And you really have been providing a great service with these informative briefings and having Dr. Whalen here every day as well. And I know with your website, and you're able to check your own neighborhood. I saw you demonstrate that yesterday. I mean, it's really just incredible what you're doing, helping people navigate through a very, very challenging time. And I think you're absolutely right in acknowledging the partnership with Governor Cuomo in New York State. Governor has certainly done an outstanding job in communicating as well, even with the president yesterday, as we heard, right? Yes, and some good came out of that, and that's very important. And at a time where everyone is talking about the need for testing, Albany County seems to be on the cutting edge of having those mobile testing sites. And so the work you're doing really is incredible in concert with the other local officials that you have here in this county. So it's a privilege to be with you. And I also appreciate, as you do every day, remembering the human dimension here. I mean, I'm going to talk some numbers and economic impact and pension fund and so on, but the real issue is the public health emergency, the sickness, the loss of life, the human impact. I don't know how you ever calculate that, the families that are being affected. Just incredible. And lastly, before I get into my the data points I wanted to share, to the county workers, certainly those on the front line, those working in healthcare, the doctors, the nurses, the emergency responders, those are providing vital services. Essential services really is just incredible, keeping this community moving and getting through all this. And we will get through all this. As others have said, the numbers seem to be showing that we've hit the plateau. The curve hopefully is going in the downward direction, but it is going to take time. We all know from the national and international discussions that New York is the epicenter of the COVID-19 crisis. Certainly downstate, where I get to go on weekends now and then, we're feeling it on Long Island, certainly New York City, but as we know, Albany County, all of our counties are affected in some way. So keeping in mind our first concern is the well-being of our population. The other impact of this crisis is on our economy, and then by extension on the revenues that come to state and local governments and the ability for us to do the work that we have to do. So we are in a new economic reality. We are in a challenging landscape. And County Executive McCoy, the reality is we still don't know where it's all headed. So a lot of what we're talking about is still very tentative information because this is still very much a work in progress on the economic and governmental front, just as it is on the public health side as well. Many of you recall that in mid-March, the governor asked our office to come up with a new revenue estimate for the state as they were closing in on finalizing the budget. We estimated that the impact of this crisis would conservatively result in a $4 billion revenue hit to the state, lower than what was first estimated, to as much as $7 billion or more. Well, where are we at now, over a month later? The range is really more like 10 to 15 billion, and we're still not sure. The freezing of the economy, the lack of business activity, unemployment, sales tax revenue certainly taking a big hit. That's important to the state, but it's important to our local governments as well. Our counties depend on that sales tax revenue, as Dan knows very, very well. I think that NISAC projected for Albany County, the loss could be between 4% and 12% of annual sales tax revenue. And the state faces a similar issue with income tax revenue. People aren't working. Obviously, they have no taxes to pay. And on top of it, and this is a good thing, in response to the crisis, a delay in the filing of your taxes to July means that in this, what is now the first quarter of our fiscal year, a lot of the revenue that we might have expected will be put off. If somebody owes taxes, chances are they're going to wait till July to pay that. So we also had months like May and June. We have big commitments as far as school aid payments, other payments. So we really are facing a cash flow crunch right now. We just put out our budget report today, and navigating just April, May, and June is going to be a real challenge. As you know, the legislature and the governor did get the budget done pretty much on time, but in many ways the budget is a work in progress. So there are placeholders in there for broad discretion for the governor to adjust spending, and much of New York State's budget, as county executive knows, goes back to localities. School aid for our school districts, money for counties, towns, villages, and cities as well. And if the money's not coming in, the governor may have to adjust those numbers downward. Unemployment's been a big concern, as you know, nationwide in New York State, and the Department of Labor has now updated the way in which for people to apply for unemployment. They're working with our office because once the Department of Labor processes the application, we're the final part of that process to make sure that the benefits are paid out. And I know the goal is to have a 48-hour turnaround. We keep it a priority for us to get those benefit payments out the door as soon as we get the information from the Department of Labor. So those who may have questions, as you know, the website is labor.ny.gov. The 800 number is 888-209-8124 if you still have questions about that, and we are making that a priority and expediting it. As you know, the Senate passed, and the House hopefully will pass by the end of the week, additional federal support, some $484 billion, largely for small businesses, hospitals, some for testing. But what's really needed is more help from Washington. We just penned an op-ed that ran in Newsday that really says the next iteration of federal support has to be direct and unrestricted aid to our states and to our localities. There was some initial money in the first go-around. For localities, you have to be a population of 500,000 or more. That left your communities out, right?
Left us out.
Left you out. And so here's why this is important. First of all, it has to start with the state, because if the state has a budget hole, the governor said this clearly, not as a threat, just as the reality. If we don't have the money, then the money that would flow to Albany County and the localities here, it's not going to happen. He's going to have to adjust those numbers downward. So if the federal government will help plug the hole in the state budget, that will ensure that we could keep the commitments, conservative as they are, to our localities. But we mentioned the sales tax hit alone. You have people that if they're not working, they may not be able to pay their property taxes. You're going to have a hit at the county level, and certainly the city, the towns, and the villages as well. And that's why more federal support directly to our localities, I think, is very key as well. And that's what we need to navigate through this process. We're certainly going to continue to advocate for that. Just very quickly, I know we have many state and local government workers here in Albany County who care about the state pension fund. The county executive asked me about that before we came down. Look, we went into this difficult time as one of the best funded public pension plans in the nation. That is a source of strength, and that should be a source of comfort. That being said, we value the pension fund once a year, March 31st. It wasn't the best date to have to value the fund. So we are going to take a hit. We don't have the final numbers yet because there's always a lag with our alternative investments. Just in terms of context, when we had the global financial crisis and the start of the Great Recession, also March was the wrong month to value, but that's the way we do it. We were down, county exec, 26% in 1 year. We're nowhere near that, so that's the good news. So the pension fund is still strong. We will keep you updated on the numbers. We have plenty of liquidity. Again, because we go into this situation in a strong position, we will weather it just as we've weathered other storms. So pension checks are being paid on time. We have no issue with not having enough cash on hand. So, just keep in mind that people should not worry about their pensions, and that money continues to flow. We did ask the governor, and I was very pleased Governor Cuomo signed an executive order that we requested to, at least through this crisis, waive the statutory 15-day waiting period before a public employee's service retirement can take effect. Why is that important? Under the statute right now, you file for your retirement, but there's a 15-day waiting period before it actually takes effect. If you pass away before that 15 days are up, your beneficiaries don't get the retirement, they get the death benefit, but for many, getting that beneficiary pension is more important, more valuable. We have folks now, public workers on the front line. Unfortunately, some of them are coming down with COVID-19. And we have had very limited situations, but some where people have passed away before the 15 days have been up. So we ask for a waiver of that 15-day so that if your intention is that your beneficiary should get your pension, if God forbid you pass away because of what we're going through, we don't want to see you penalized. Governor signed that executive order retroactively, so those that have been affected already will be covered. So I'm glad to get this information. This just happened, so this is new information, and we'll be publicizing that. So let me wrap it up. We have some quick slides, I think, that give some more information if people want to follow up. So like everybody, we got our website, osc.state.ny.us, our phone number, 518-474-4040. Our website is very easy to navigate, and we want people to go to it. We set up a special financial toolkit, particular ways in which there are resources for people, issues relating to employment, if you're a nonprofit, obviously pension, payroll. We're encouraging people, if you haven't already, sign up for direct deposit for your pension checks. We still have about 30,000 retirees that get their check the old-fashioned way. And in this environment, direct deposit is even better. And even state workers, we still have about 17,000 that don't do direct deposit. But more and more people are signing up. And then we have various resources as well about benefits, financial assistance, how to do direct deposit, and call us, email us. We're there to help in any way that we can. And again, County Executive McCoy, thank you for your great leadership and your great partnership through this crisis.
No, thank you for being there for us all the time in the community. I do feel like you are a resident of Albany County because you do spend so much time here, so I do appreciate it. Not just your friendship, but your leadership, and on a statewide level, but especially here in Albany County. Everyone knows you're so approachable. We can talk to you, and you're always there to help us. And just to kind of talk about the recession of 08-09 that the controller talked about, that took us like 8 years to dig out of, and we had to amortize our state retirement system. Just to let people know, our state retirement bill is roughly about $23 million a year that we pay for people for their retirement when they retire from Albany County, and they're entitled to that. But when the years were difficult, we had to amortize it, and meaning that we kind of kicked the can down the road a little bit, but the controller worked with us, and we owed the state controller since 08 roughly $38 million. We knocked that down to $14 million, I like to say, and I was hoping to have that paid off this year, but unfortunately now we're into this recession that we're in, and it becomes issues. And I have talked to county executives across the state of New York and across this nation in both roles as NISAC president and president of County Executives of America, And one of the things I did reach out to our legislature yesterday was about delivering a budget in November instead of the 10th of October. And the reason being is because there's so many uncertainties we don't know. And if the state doesn't get the money they're entitled from the federal government, as the controller said, it's going to come down to the counties. So my budget, I have no idea. I have an idea where we're headed, but until I know what the governor's intentions are after October, we really don't know how much of this is going to be pushed down to the counties, and I imagine a great portion, or they're going to cut back on aid on a variety of things, and we have to adjust our budget. That's why I reached out to the legislature yesterday saying, I'm going to put up an RLA, and I'm going to request that I can deliver a budget the 10th of November versus the 10th of October because of the uncertainty times that we're in, and hopefully they go along with that. And I plan on working with them to get through this because it's going to take all of us sitting in a room working together at a social distance to make this happen. So I do want to thank the chair and the majority's office, Dennis Feeney and Frank and Andrew, for being open-minded about this process going forward, and we're gonna need that. But before I move on, Dr. Whalen.
Thank you, County Executive McCoy, and thank you, Mr. DiNapoli. This was great information for the residents of Albany County. So as the county executive discussed, we've had 4 additional deaths, and unfortunately, this trend of those that are the most vulnerable, our elderly population being most affected by COVID-19, is continuing. This is the reason why it's important to continue our social distancing. And as we learn more and more about asymptomatic spread, we will be able to better inform decisions about how we move forward with public life. We have seen a number of cases climb due to cases in the nursing homes around the area. And the reason for this is, as we know with testing, once we do more testing, we get more positive results. Because the fact that the state and county have worked together to be very active when we find a case in the nursing home, there's a lot of testing of symptomatic and asymptomatic residents and staff, and we are seeing cases rise in those situations, and we continue to monitor them. Yesterday, the governor announced a phased approach to reopening, and part of this was a discussion around instituting elective surgeries in different areas of the state. Albany was notably left out of that because the numbers that we currently have, so we will continue to monitor those trends. As we discussed yesterday when I reviewed the data from the COVID tracker, if we look at our daily trends, we are at a plateau. We had a day where we had 5 cases and we wondered whether this was a blip or whether we were starting to see a downward trend. Overnight, getting 33 cases, it appears that it might have been a blip, but we will continue to follow those very important statistics along to learn how this is unfolding in our community. We continue at the health department to be very active with our disease finding, our contact tracing, and our isolation and quarantine programs. I again would like to commend the county executive for the tremendous outpouring of support that we have received at the health department. We at the health department have a fantastic team. I'm lucky to work with people like my Deputy Commissioner Mary Beth Miller, who's been there for over 30 years, who brings an incredible amount of experience and knowledge of the health department, and there are many others that I work with that have been instrumental in this response. But as I've said all along, we have been at surge from day one. Without the additional support that we have received from other county agencies, from others that have contributed to the food banks, et cetera, that allow us to provide food to those in need and provide services to those in need, to our Department of DSS, who is assisting us with cases that are homeless, to our Department of Mental Health, because we know this is not only a public health crisis, but this, for many people, is a mental health crisis. This has been an incredible example of coming together, utilizing county and community resources. And we have partnered with our healthcare providers. Whitney Young has been a great partnership. To date, there have been 364 people tested by the mobile sites, and we will continue to follow that along. That has been a great resource. The mobile testing at SUNY is also continuing in its efforts to address this on a regional basis. Again, that's not just a county test site, but it's a regional test site, so it's available for residents in surrounding counties. Basically, anyone that can drive to that site and make an appointment can be tested. We need to continue our increased vigilance and our increased testing. As I discussed yesterday, I think the information that we will gain from the antibody testing will be key in informing us to how we move forward as a county and as a state. So I think within the next couple of weeks, hopefully, we will get a better picture and be able to talk more about the situation around asymptomatic spread and actions that we may need to consider going forward with reopening.
Thank you, Dr. Whalen. And I don't know if I brought this up, but the testing sites, the mobile testing sites, it was a question yesterday, we didn't have the numbers. We're up to 250 people that have been tested through the mobile testing sites. I'm sorry if I didn't bring that up.
I think it was 364 this morning.
Oh, 364
Yeah.
this morning. 364 this morning. So it's 364, and I can't thank Whitney Young and everyone now getting the message out there throughout the community. So thank you about that. Some other good news before we end this. I do want to say to our youth bureau for spearheading an effort to put goodie bags together to get to kids that are in quarantine that are being delivered by the National Guard, along with our food boxes. Thank you to the National Guard, and thank you to our youth bureau and everyone involved with this project, and to the smiles on the kids' faces that are that are quarantined, and gives them something new to do, and helps with the parents, keep them a little preoccupied. So thank you. And then also, I do want to say a huge thank you to the encouragement for our staff at Shaker Place. Yesterday I was out there, and again, I still couldn't get through the nursing home, but we gave breakfast sandwiches out, and our nursing home director wouldn't let me go 2 feet past the front door, rightfully so. And but I do want to say to the workers and everyone, thank you, and to the outpouring of not just from the families that have families there, but people in general supporting the staff, because these men and women, they're tired. They're tired, and they're out there every day doing a great job protecting our loved ones that are in our nursing home. So thank you for what you're doing. I also want to mark the 50th anniversary of Earth Day. We do encourage people to go outside and enjoy, get fresh air, but it's a little tougher right now. But thank you for that. And people that are on a rail trail, we want you to use it. Social distance, but please, if you're using gloves and masks, don't throw it on the side of the rail trail. That's been a huge complaint. We went out to check it out, and it has been a complaint, and we did see people's masks and gloves. I don't know if you think someone's going to come through the middle of the night and clean your mess up. Be responsible. Pick up after yourself, please. I don't think that's asking much. And keep our residents healthy and safe. That's through this crisis is what we're committed to here in Albany County, because we do care. Albany County cares. So thank you to everyone that's been involved with that. And I do want to say, if you have any questions about our mental health, we've said this, we established this day 2 when we started this on March 13th, 7 days a week, 8 a.m. to 8 p.m. It's free. Call whatever your issues might be, area code 518-269-6634. Some of the comments we got, no, we're not sending people to people's houses and locking you up, folks. I know that was some people put that out there that, if I call and they think I'm crazy, they're going to lock. No, we're not there. We're there to calm you down and get you the help that you need. So please, the people that are being the Monday quarterbacks on social media because you're sitting home and you're bored, try to preoccupy your time in a positive way. That helps out your residents, not just going out there and calling out what you don't like. find a solution to the problem. That's my challenge to you one-day quarterbacks that are out there. Find a solution to the issues. Stop belly aching about it. Also, the 211 number from United Way and the New York State hotline, as always, thank you to that, and OTB for broadcasting this as always. But I do want to hash on one thing, and you probably got questions for either Dr. Whalen or our great controller, DiNapoli, but I don't know if people realize this. Being a former firefighter for 21 years, the biggest issue you have when you go to retire and you're on the front lines is that you get to that retirement age, and especially with this going on. If you haven't seen the way this has affected New York City police officers and firefighters, and I don't want to give a number out, but a lot of them have passed away from this because being exposed is your loved one, your partner. They don't get your benefits. Yeah, they'll get 3 years of your salary, and Tom can talk better about this, but the fact that our controller got this done with the governor is huge news. I mean, and even not just firefighters and EMS people, but workers in general that are coming to work and keeping the state running and keeping the counties and villages and towns running, it's a load off your mind, because you go, do I retire to protect my family and make sure they have health care and benefits the rest of their life? Or do I continue to go out to my job? And that is no small accomplishment. And to your credit, I want to say thank you for what you did in the governor. I mean, just hearing about it now, and like I said, being a former firefighter, it's incredible. It's incredible. So thank you.